Hi everyone, this is Dr. Mehmet Erdoğan by Smile Hair Clinic. Today I would like to share with one of my patients' experience and his case study to you. Our patient is 33 years old from United States. He did his surgery on 2023 at December, so we are almost in the 14th month of his result. But we are evaluating his 9-month photo result together today. So let's jump into his file first. We have his photos from when he sends from the home, but also we have some photos from here too. So let's start with that. As you see, the front part is a semicircular part. Then we have a mid scalp and the crown area. Front is already receded like a male pattern baldness. Then it started already with the mid scalp as well. And in mid scalp, sometimes, according to the Norwood scale, it's just becoming more wider. It hasn't happened with him. It's a very good thing because it limits and it reduces the graph number that's going to happen. So we always want to have that. In the crown area also it's a circular area, but circle is small right now. But it's going to be wider, it's going to be extended. At that time, it just merged with the donor area, and the donor area size becoming more smaller and more narrower, and we don't want that. I mean, yes, there is a coincidence that you can see, yes, it's going to be lost already. So the donor area, if you lose them, it's okay. But always we have a finasteride and minoxidil option, which can also regulate and keep those hairs from falling off. That's the reason for that kind of patients, we always recommend to use those kind of medications. So his condition, of course, his request is to create a hairline to fill the frontal part. Then with the rest of remaining grafts, we are going to use for the other parts. So we planned his condition. His planning is just with these kind of patients. I mean, not for this kind of patients. I'm also for recommending for most of the patients that we are dealing with. We don't want to lower the hairline because it just extends the hair part that is going to be restored. And even now, today we complete everything. If he's a candidate for hair loss for the future, and if it happens again, it should be those expanded area must include more hairs inside. So at that time we don't have the new source in the donor area, so it's a limited time at that time. That's the reason lowering the line is not a good option for most of the patients, and I think his condition was ideal, and he also accepted to have the similar hairline. So we planned his hairline, the both temporal part, the frontal part, mid scalp and the crown. And if we check the implanted photos after the operation, it looks like the frontal part's density is very good. Mid scalp, there is a transition part, and the crown area is also restored in a good way. Let's check his 13th day photo. I think these days are very important for the patients because everyone is curious when they go out, so it's very important to see their final result at those times. In the second week with the transplantation, the patient's condition is a little bit growing hairs, and sometimes according to the circulation problems or circulation, we may see the shock loss from the second or third month. But if the patient is on finasteride already or used minoxidil for a long time, this patient haven't that. At that time we see a little shock loss, and also the hairs grow much earlier than expected. So the front part is looking good. There are some scabs because probably he didn't remove every part of those scabs that is formed by the time for the dry skin, but already its front part is looking good. Mid scalp, where the existing hairs are grown a little longer because they are not shaved, that's the reason there is a contrast difference, but overall it's as expected. So let's get into the 3rd month photo. He is a similar condition that he came to the clinic. We don't see too much on the temporal parts. Maybe his hair is a little bit grown, that's the reason it looks a little different. Crown area is better than expected, better than before I think. Sometimes in some part of the hairs could be grown different than the other hairs because they are not synchronized to each other. So not too much different I think in the 3rd month. It's very early probably for him. It's not like a calendar. We don't see the beginning of the 3rd month, we don't see anything. Sometimes it depends on the following months. So we have the 6-month photo. Let's check that. Yeah, too much different. I mean, he's a totally different guy. His front is filled. His mid scalp is already good. Crown is getting better, and his frontal appearance is totally changed. So this is the thing that we want to see with this kind of patients, because it gives a different self-esteem marking to the patient. Yes, still some areas that is lower density appearance, which is very normal because it's a 6 month, and after some months we see the thickening occurs. It's not like the hair just grows and it is as thick as the hair caliber. Sometimes the thickness occurs within few months. So let's check his let's check his crown. Very good, it looks good. His donor area already healed. Yeah, overall 6 months is good, but I think much better is the 9-month photo. So let's check that right now. So it is much better right now. The front is almost covered. Mid scalp is very good. Crown, yes, in some points I think still we can see, but still a very good improvement for the crown area for that number. The front is looking very well according to his face, according to his face expressions. The frame, I think still very looking good, very handsome right now. His donor area already healed. There is not too much noticeable with the transplantation. And from looking from the top, you can see that frontal density is very good too. So I think I'm very pleased with the result with the patient, and I think patient is also happy. We can understand that from his comments and from his messages to us. So if the patient is happy, we are happy, because that's the thing that we want with everyone. So thank you for watching us. If you still have some questions, please write on the comments below and we would like to answer them. Thank you.